Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give valuable comments. You can also visit the playlist. In the playlist I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, we have been discussing about role of Panchakarma in neurological disorders in children. So now, whether the given case of neurological problem, whether it is avarana or not, this we have to identify, because whether it's a kshaya, vriddhi or prakopa, that we have seen, whether it is margavarodha janya or dhatukshaya, that also we have seen. Now let us see whether the given disease is avarana janya or not. Now how to identify the avaranas? Avaranas, as explained in the classics, avaranas can be identified by the lakshanas and also by the guhyas, inference. Lakshana means by symptoms. Now, Vata Avruta. Vata is always Avruta and it is always covered by Kapha and Pitta in case of Avarana. Okay, Kapha Pitta is causing Avarana to the Vata. Therefore, Vata is called as Avruta. So, when Vata is get Avruta by this Kapha and Pitta, the symptoms of Pitta and Kapha will going to increase and symptoms of Vata will going to decrease because it has been covered. Okay. So this should be identified by the decreased action of the Vata. That means decreased action of the movement or any other neurological functions, and increased action of the functions of either Pitta or Kapha. You would have Pitta, burning sensations may be more, for example. Okay, so or inactivity will be there because Vata action is decreased. Vata action is Uksaha, Nichvasa, Uchvasa, etc. Many things are there. So that particular action, normal function of the Vata is decreased. But functions of the or symptoms of the Pitta and Kapha is increasing. That suggests that it is not a pure Vata Vyadhi, it is a Avaranajanya Vata Vyadhi. Vata is get covered up. For example, in case of storage disorders, you take the example of storage disorders and all. The symptoms of either metabolic disorders or storage disorders, symptoms of Pitta and Vata will go into Pitta and Kapha will go into increase there. Whereas symptoms of Vata will go into, or presentation of the Vata will go into decrease, normal functions. So that one thing that you can identify, yes, I am dealing with a Avarana case. By Uhya also, by inference also you can identify. How? Those Avarana which is not mentioned in the classics should be also assessed by looking at the increase or decrease in the symptoms by using Agama Pramana. This is Agama Pramana. This is told in the classics. Okay. Many times in the classics it is not mentioned whether which type of avarana it is, but you can identify it. Yes, Vata symptoms are, Vataja lakshanas are decreased, Kapha and Pittaja lakshanas are increasing. So now you can identify by your own. Similarly, we know that avarana means it is Gati Rodha. Gati Rodha. Okay, normal movement of the Vata is blocked. There is alteration in the Gati or there is stoppage because of Avarodha. So that stoppage and that particular Gati Rodha may be because of Dhatu, it may be because of Mala, sometimes it may be also because of subtype of the doshas, because of subtype of the doshas like Udana, Urta, Vyana, etc. So therefore, when you look into the children, all the neurological problems which are occurring because of storage disorder, metabolic disorders, etc. So they can be considered under the heading of Avaranajanya Vyadhis. Now, Vatakshayajanya and Dhatukshayajanya and Margavarodhanya we have identified by the presentation, whether it is a chronic presentation or whether it is a acute presentation, whether it is Santarpanota, whether it is Apatarpanota. But here we have to identify the symptoms. Okay, if the neurological symptoms are less, or normal neurological functions are decreased, and the symptoms of the other Pitta and Kapha is increased, so then it is a clue we have to identify, because treatment will going to differ. Here, if this is a case, unless and until you going to treat the Pitta and Kapha and remove the Avarana, the symptoms will not decrease. Presentation, that means the cure cannot be possible. Yes, now identification of the avarana. Pitta avruta vata. Sometimes pitta dosha is get avruta by the vata. Okay. So that means that samprapti of avarana at the vayu, samprapti of avarana of the vayu at pitta sthana. That leads to pitta avrta vata. Whereas in kapha avrta vata, samprapti of the vata avarana at a kapha sthana. Okay, that is dosha avrta vatas. Now anyonya avarana is seen, that is prana avrta apana, udhana avrta prana. That is, functions of the apana will be blocked by the prana vayu. Functions of the prana is blocked by the udana vayu. Okay, etc. Problems may be there. Now, avarta vata is always hidden and will not be exhibited properly. This is told by Ashtanga. Okay, so avarta vatas most of the time they are not open up completely. They are most of the time hidden. So it may be a pre-disease like condition, or it may be sometime complications. It may be because of metabolic problem, endocrinal problems, or neurological problems. Okay, so it may be an ongoing disease state which is difficult to diagnose at times. If you want more details, Ashtanga Hridaya Nidana Sthana, it is very clearly told that it is Dussadhyas. And if you go through the chapter, very interesting facts are given about avarta vata. So these are some of the references given. Pitta, avarta, prana or udhana lakshanas. Okay, for example, Brahma, Murcha, Ruja, Vamana, then Daha, Antar Ruja, Brahma, etc. will be there in Pitta, Avarta Prana or Pitta, Avarta Udana. So if you look into this, it is the symptoms which are seen in case of essential hypertension. Okay, most of the symptoms, Ruja, Vamana, Murcha, Brahma, Daha, etc. Similarly, Udana, Avarta Prana. Udana, Avarta Prana. So here the symptoms will be Nishwasa, Uchvasa Samrodha, then Shirograha, Rudroga, etc. are seen. So Rudroga is there in Udana Avarta Prana. So this may be a conditions like chronic obstructive pulmonary disorders, or maybe an advanced case of hypertension, etc. Pitta Avarta Vyana is there. So here Pitta is there, Vyana is Avarta. Vyana is one which is responsible for the movement of the movement. That is blocked by the pitta. So you will have daha, klama, angachesta, then sanga, vedana and santapa, etc. This may be because of some transient ischemic attacks like condition where suddenly patient is falling and then he is getting up after some time, etc. Kapha avarta vyana, udhana and prana. So here guru gatrata is there, aruchi is there, vak swara graha is there, along with the bala varna pranasha and so gatra, that means skalita cha gatra, that means over increase of the weight, increase in the weight, etc. So dyslipidemia with the atherosclerotic changes and obesity can be identified with. See, these are all the pre-disease conditions many times. Many times these are the complications. So avarta vata has got a many wide range of understanding. Okay. So now you have to see the given neurological problem to you, whether it is also coming under this category or not, whether it's a pre-disease condition, is it a complication of some other problems. So that also we have to see. So next class we shall start with what actually vata is and how to apply this particular knowledge in the treatment of neurological disease, and then how to apply the panchakarma treatment. Thank you.